Good morning, everybody. This is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. This video today is on Broca's aphasia and the team effort. Okay, so let's first break it down. We're going to talk about Broca's aphasia for a minute. I've had lots of experience and background with Broca's aphasia because what Broca's aphasia is difficulty initiating speech. So we all know that sometimes we have difficulty initiating things. Sometimes it might be difficulty initiating some things that we have on our to-do list. Sometimes we have difficulty initiating a conversation that we need to have with somebody because we may be in conflict. But this is different with Broca's aphasia. Imagine that you have something that you want to say and you go to say it and the words just don't come out. You know what it is you want to say, but it's as if the lines of communication between the brain and the mouth and the tongue, as if there is a breakdown, as if there was like a fuse that blew or a circuit breaker that's not working. And so what happens is that there's a shutdown. There's a shutdown in the communication between the brain and the tongue and the throat and the voice and the lips and the articulators of speech. So many of you have had the experience of a blown fuse or a blown circuit breaker where all of a sudden you go to use an appliance and it just doesn't work. The appliance is there, the hardware is there, ready to do its job, but the current that makes it operational just is not functional, is not working. And that's what happens with speaking. So one of the things that I've realized is that Broca's aphasia, you can have improvement in Broca's aphasia. Now, you got to remember, too, that there are lots of different severities in Broca's aphasia. So sometimes a Broca's aphasia can be profound, and even when you do speech therapy, the progress can be very slow. But here's the thing. You know, I've worked with some people 2 years or more, and they're coming along with their ability to speak. They're on the road. They're on the path to speaking improvement. And, you know, speaking improvement doesn't really improve when the individual with aphasia is typically in charge of the therapy. You can't really do it yourself. And a lot of people with aphasia tell me that they don't want their wife to be involved, and they want to do it themselves. And there's some people who just are that way. But what happens is that the progress that is made is minimal. Because you got to remember that to improve talking requires talking. You know, it's not like studying for a bar exam. It's not like reading the directions for how to put something together. And there are a lot of men who are really self-sufficient, a lot of women who are self-sufficient and want to do it themselves. But that's a big mistake. It's a real big mistake because talking is different than putting something together. Talking requires two people to converse and interchange ideas. And that's what's so necessary. So what I've found is that I have a few people I work with who are, they're like interns. We used to watch shows on TV about interns, and the interns would be working in the hospital, and they would come to the guru, the head doctor, and the head doctor would teach them about how to make a proper diagnosis, or they would teach the head doctor would teach the intern about how to treat a particular problem that maybe is difficult to address. So I look at it with the people we work with the teaching of talking as if the caregivers are sort of like interns. They don't know anything about speech pathology, most of them. Many of them have been thrown into a situation where they didn't know what to do. They didn't know how to help their loved one talk. They thought, the person who was responsible for that is the speech pathologist. Well, yes, the speech pathologist can teach the caregiver what to do and how to do it. But in the long run, as many of you know who listen to these videos, the caregiver is the one who can really make the difference. And so therefore it takes a team effort. And there are always so many aspects of aphasia to address. First, there's getting them to recall words, and then there's getting them to answer questions, simple questions. And then there's expanding the questions into phrases. And then there's expanding the phrases into sentences. And then there's the grammar, because quite often the grammar of speaking is significantly affected, and people with aphasia have difficulty with present tense, past tense, irregular tenses, and so on and so forth. There are lots of grammatical errors, simple grammatical errors, that call undue attention to themselves. And so there are so many aspects of aphasia that a speech pathologist has to address. So it's not like one thing that a speech pathologist has to address. And that's another one of the big problems. People are thinking today that an iPad, which is a computer, they think that an iPad can help a person return to speaking. Well, it's good for some aspects of speech or language, but you can't talk to it. You can't interact with it. It can't identify lots of things that a speech professional can identify: the grammar, the rate of speed, the rhythm of speed, the articulation of speech, choosing the right sounds to address, how to fix an apraxia of speech, all these things. But something, a lot of caregivers, they have an aphasia, and somebody might say, well, get this app or get this app. And that's a crazy way to address aphasia, because aphasia is a lot more complex than buying an app or buying an iPad. So please remember that. So the whole key to this presentation today, to this video, is that if you really, truly want to help your loved one regain the ability to talk, then usually it's the responsibility of a family member to do it. Unfortunately, there are many family members who do not choose to do that. And it's a real shame, because the possibilities for improvement of speech for those with aphasia can be very positive. And it all depends on how much you stimulate speech, the frequency that you stimulate speech, whether or not you're doing it each and every day. Because the people I work with, gosh, they're on it. I mean, they're on it all the time. In fact, many of them are on it to whenever the individual with aphasia wants to say anything, that person is there to help them construct the thought and then to put it into words. And usually those thoughts are repeatable. And once a caregiver or a care partner learns what to do to help a person with aphasia, they can do it each and every day in every way. So make sure that you team up with the person who has aphasia and with the therapist especially, and learn about how to help people with aphasia speak better, especially if they love you and you love them and you want to see them return to the ability to communicate with you or with the other family members or members in your community. So this is Mark Ittleman, speech-language pathologist, wishing you a wonderful day today. Below this video is a link which goes to our website at teachingoftalking.com. And when you're there, please get on our mailing list so that we can send you these videos and we can send you blogs and other information that we know will be helpful for you so that you can learn how to help people with aphasia. Now, what you can also do is there's on the website, if you go there, and down below, there's a link to a questionnaire. So if you ever want to speak to me or you have a question about something, just fill out the little survey questionnaire and tell me a little bit about yourself and about what your challenge is, and we'll arrange for a personal conversation. So on that, don't forget to click on the website down below, and we'll see you on the next video. Thanks again. This is Mark Ittleman, speech-language pathologist. Bye-bye now.